María Ángeles Tortosa.
Great. And in which city and country are you based?
Yeah, in Valencia city, and this is at the Mediterranean coast of the country, Spain.
Great. What organization do you work for?
The University of Valencia.
Great.
At the Faculty of Economics and at the Department of Applied Economics.
Great. Okay. How would you explain what you do, simply?
I'm mainly a teacher.
Okay.
But I like also doing research, so I try to find time for doing research.
Great. And what do you like to research?
Well, in older people care.
Okay.
Yes.
Great. What is commonly understood as long-term care in Spain?
Well, this type of services that are targeted to resolve some kind of needs that are social, and sometimes they are also health related with health.
Okay, perfect.
Or mainly those who have frail situation or less autonomy or doing other daily activities.
Okay, good. What would you say are the three main policy priorities for long-term care in Spain at the moment?
At this moment, at present time?
Yes.
Well, as you have here in this Congress, mainly nowadays is saving money, because we want to make sustainable financially what is our ambitious system that we implanted some years ago.
Mm-hmm.
But a part of that maybe is not a priority, but it is dominating all what it is the rest of the priorities, is taking care of those with more need, especially that are those who have these disabilities and high level of dependency, if it is possible, at home as much as possible,
mm-hmm.
or in those other places where they decide,
okay.
they wish to be.
Okay. And to what extent have the priorities changed over the last 5 to 10 years?
Yeah, well, even a little bit more. No, I forgot to tell that there is other priority that
sure.
is in connection with family cares. That means that our surveys are telling us that family carers want to be helped by the state. So in some way, this new system is also taking care with cash and other kind of service benefits to family cares.
Okay.
So this new one, if there has been changes in these priorities,
yeah.
Just because the system has changed. We have a new system since 2007.
Okay.
That's more or less the time you were telling me.
Mm-hmm.
So it has changed to be more ambitious. This means to be universal and to cap as much people as possible that has needs.
Okay.
So priorities has been spreading the basic ones I were telling were also older than this period you are telling me, but they have been put in practice through this design of an stand system. Because before we were covering only a small amount of groups.
Oh, I see. Okay.
And those more poor with less family and they were living alone and with a lot of degree of dependency. So a lot of people with need were not covered by the system.
I see.
So what we have achieved at least is a new system that is increasing the number of people who will be included.
Okay. And what do you think will happen to the system in the next 10 years or so?
Well, it is happening now with the situation has changed dramatically, and that means that we cannot be so generous.
Mm-hmm.
So we have to, in this moment, we are re-evaluating everything and rethinking the system to make some strict conditions for those who finally will receive the services.
Okay.
That means that at the end there will be some cuts, and that has been last month. There has been some measures that has introduced, for example, for family cares, some kind of reductions on these costs.
I see.
And service benefits.
Okay. And if you had the opportunity to introduce one new policy reform, what would it be and why?
Difficult to say. Well, I'm specialized in funding formal services. So one of the measures that I'm studying is rethink the methodology that exists, for example, for some formal services like the basic one, nursing homes and home health, to be more homogeneous among what are the difference among comunidades autónomas or regions.
Okay.
To distribute the money in another way that could be, I think, more equitable.
Okay.
And maybe through that could be a solution of big differences or having some kind of savings.
Okay.
That is one thing that I know better because I studied.
Makes sense, yeah. In your view, what is the most important piece of policy or research evidence that we need in order to make policy changes or to inform policy in Spain?
Wow. Great question. Yes. Well, nowadays people think that it's a question of coordinating better health system and social care because they are very related. That seems one of the challenges nowadays. But as I'm an economist, I think that not also this one is rethinking how is functioning nowadays. That is inside of these nursing homes, of the home care, what we need to improve because there are a lot of inefficiencies or inequities that we can resolve, and this will be improvements.
Okay.
I forgot to say, but maybe in that priorities, another one different from this that I referred before.
Okay.
Maybe it will spread the home health because there are communities that the provision is close to 0 or 1%. That means that they have no home health developed.
Wow.
So there are a lot of possibilities here of developing new ways to introduce this home health.
Okay.
With more people. Other people could tell you, other researchers, that maybe this is what we call a sector that could help us as a nation to increase employment, because here we have different sectors that due to this situation, this sad situation, can improve the degree of unemployment we have, and this could be one if we develop correctly. For example, home health can be one of the sectors that can be rising the provision, and we have staff in the sense that we have a lot of students and people that is qualified. They are coming to this country because there are no possibilities to find, for example, places and jobs in these formal services.
Wow. Yeah. To close off, I have about 5 quick questions to ask you. Could you rate on a scale between 1 and 10 your answers to the following questions? What policy priority is allocated to long-term care in Spain?
The ones I have told you, from those I have told you, or which priority?
Generally.
Generally?
How important is long-term care in Spain? 1 to 10?
Nowadays, it's the fourth pillar of the welfare state, so it has been a higher priority
Okay.
in the last government party.
Okay.
I think it will be nowadays in 6%.
6. Okay. And how aware is the general public about what the long-term care system offers them?
Not so much. Unfortunately, not so much. That means that we lack on having better provision of information to them.
Okay.
And even if they have information, people don't want to read. So sometimes they have information from TV maybe, but this is a lot of money.
Okay.
So I think 5%.
5, okay.
And I'm optimistic.
Okay, okay. And how well does the system support people with long-term care needs?
No, not well. There is a lack of being better connected. What is the process from when they have been assessed till they receive real service? So nowadays I will say that those who enter to this new system has to wait, some of them till 2 years, and sometimes they die. So they are not taking well care of these needs. This means I think 3%.
3.
I'm optimistic.
Okay. And how well do you think the system supports carers?
Well, the system nowadays it has been proved that it helps a lot carers, because from all the possibilities there has been of prestaciones, what we call prestaciones. The one with more success is this cash to family cares.
Okay.
Near 52% of the prestaciones goes directly to the family cares. So it has been a success for them.
Yeah, yeah.
Because we recognize their burden, their activities, and we put money a salary to them. And also we have some social security tax benefit because they can entitled to receive after a pension for receiving this wage.
Okay.
So that's very good treatment. I would say 8.
8, great. And how integrated do you think the health and social care systems are in your country?
They are not integrated.
Not
in
at
the
all.
sense, no. They are not. They are developing separately. We have very well developed health system, super specialized, that is not thinking on how to be integrated with social care. It's not true that there are not isolated initiatives that try to improve this, and there are coming new proposals from different regional governments, like País Vasco and etc. And they are trying to implant it new coordinations, but it's very difficult.
Okay. Thanks very much.
No, I didn't tell you from 1 to 10. I
Please
have
do.
to say 1 to 10?
You do?
Yeah.
Sorry.
Sorry, I forgot 4.
4. Okay. Thank you.